Hey guys, I'm here with another video. Again, this is Piyush. I'm going to just talk about my clinical table summary of gallstones, and I'm just going to mainly talk about acute cholecystitis and cholelithiasis, cholelithiasis, and also cholangitis, and also gallstone pancreas. So in terms of postprandial pain, you want to think about which ones have it. So typically acute cholecystitis can have it, cholelithiasis can have it, which means gallstones. Cholelithiasis can possibly have it, and cholangitis can possibly have it, and also gallstone pancreatitis can actually have it. But the two main ones that will have the postprandial pain is going to be acute cholecystitis and cholelithiasis. Now in terms of duration of the pain, for acute cholecystitis, it's going to be greater than 2 hours. For cholelithiasis, it's going to be between 1 to 2 hours. And cholelithiasis is greater than 2 hours. And cholangitis is greater than 2 hours. And gallstone pancreas is greater than 2 hours. Now for chills, you think about infection. Typically, the main ones that will have that is acute cholecystitis and cholangitis, all right? Because it's usually with an infection, all right? Now jaundice, the main one that's going to have jaundice is cholelithiasis, the one with the long name. And also the cholangitis can have it too. Now in terms of the location of the pain, all of them, acute cholecystitis, cholelithiasis, and cholangitis, are going to have right upper quadrant pain. The one in terms of gallstone pancreas is going to be epigastric. Nausea and vomiting is typically of acute cholecystitis and cholelithiasis, typically. Now, in terms of physical exam, when you look at the scleral icterus, all right, it's going to be mainly in cholelithiasis and cholangitis. Murphy sign is going to be in acute cholecystitis. Fever is going to be mainly in acute cholecystitis and cholangitis, all right. When we talk about the elevated white blood cell count, when you look at the labs, you're going to have that in acute cholecystitis and also cholangitis, and possibly in the cholelithiasis. Now, in terms of elevated bilirubin, the main one that's going to have this cholelithiasis and also cholangitis. The elevated alkaline phosphatase is going to typically be in cholelithiasis, the long name, and also the cholangitis. Maybe gallstone pancreatitis, possibly, but those are the main two ones. I think I might have repeated that before, so I don't know why I did that, but it might be kind of late today right now. Might be around, it's pretty late here, it's about 11:45 in the evening right now, so you know, it's getting that time. You better get some rest, guys. Alright, anyway, so getting back to this, in terms of gallstones, you're going to see that in acute cholecystitis, cholelithiasis, cholelithiasis, of course, cholangitis, and gallstone pancreas. So all of them are going to have the gallstones. In terms of pericholecystic fluid, you want to think about acute cholecystitis. Gallbladder wall thickening, you want to think about acute cholecystitis. And sonographic Murphy sign, you're going to be acute cholecystitis. Okay? Because we said Murphy sign is going to be in acute cholecystitis. Alright? That's a big sign for it. So if you see Murphy sign, pick acute cholecystitis. That's a big clue. Common bile duct dilation. You can typically see that in cholelithiasis because it's affecting the common bile duct, right? And cholangitis because it's also going up the common bile duct. And then gallstone pancreas because there's a blockage possibly, or maybe inflammation. Remember, even in cancer, cancer of the pancreatic head, you know, if it's at the head, you're going to have dilation, whatever's before that, all right? So keep that in mind. So just to make sure we got acute cholecystitis right, just a quick review again. Acute cholecystitis, you're going to have postprandial pain. The duration of pain is greater than 2 hours. There's going to be chills. There's also going to be right upper quadrant pain, nausea, vomiting. In terms of physical exam, you're going to have Murphy sign, fever, elevated white blood cell count. You might have a slightly elevated alkaline phosphatase, maybe. Okay, gallstones. You're going to have pericholecystic fluid. You're going to have gallbladder wall thickening. You're also going to have a sonographic Murphy sign, all right? And that's what you're going to have in that situation. In cholelithiasis, meaning gallstones, you're going to mainly have the postprandial pain. You're going to have the pain is going to be between 1 to 2 hours. You're going to have the right upper quadrant pain. You might have nausea, vomiting, and you will definitely have gallstones. And then cholelithiasis, which is the common bile duct area, the postprandial pain, you might have that. The duration of pain is greater than 2 hours. The jaundice history is definitely there. Right upper quadrant pain, also the scleral icterus because of the jaundice, and also the elevated white blood cell count. You can have elevated bilirubin, alkaline phosphatase, and also, of course, on ultrasound you're going to see gallstones, and of course common bile duct dilation because there's something stuck there, right? Cholangitis is going to be, you're going to have possibly postprandial pain greater than 2 hours. There's going to be chills. There's definitely going to be jaundice, right upper quadrant area. There's going to be pain there. Scleral icterus is definitely going to be there. Fever is going to be there. The elevated white blood cell count is going to be there. Also the alkaline phosphatase, and also the what else? Also the gallstones are going to be there in physical exam, and also common dilation. The other thing is gallstone pancreas, like I said earlier, greater than 2 hours duration, maybe some postprandial pain. Epigastric area, that's going to have many symptoms. That's why I'm not going to list them all, but they're definitely going to have increased elevated amylase and lipase, and also gallstones are going to be there, all right, and common bile duct dilation. So remember that, all right. So keep that in mind. If you have questions, let me know. Just comment, subscribe, and like the video. Take care.